Hello, my name is Uzma Khan. I was born and raised in Pakistan and I now live in Canada. I'm a physician, a TB implementer, an advocate, and a researcher. And for the entirety of my career, I have worked in high TB burden countries. This has provided me immense amount of perspective into policy, research, implementation, and also as someone affected by TB. I have survived ocular TB. Simply speaking, that's TB of the eye. And for the longest time, I was not sure how to share my own story. I guess being a privileged, informed woman, having access to the best health services, I did not want to draw attention to myself. I could not compare my own struggles to those who don't have access to basic amenities. Yet, my story is important. I still have ocular issues, despite being declared cured and despite having access to the best health facilities. This is an important lesson, a lesson that tells us that TB defies categorization and defies stereotype. My experience in working in TB and in particular drug-resistant TB, there is a lot that I have learned, and it has truly been a humbling experience. I have seen up close the harsh reality that leaves key implementers from settings with limited resources and poor health infrastructure, struggling to participate in developing policies and making key decisions for their own countries. So I do think that the current model and donor-implementer relationship needs a rethink. We know a one-size-fits-all approach is not people-centered. It creates more suffering and burden on those affected, yet not much is being done to change this. And it took a pandemic to reassert the critical importance of flexible, timely, context-specific solutions and the value of having access to diagnostics and treatments closer to where people live and work. These are important lessons for implementers, policymakers, and donors working in TB. And it is critical to reflect and learn, and perhaps even unlearn, to create more space and opportunities to do things differently. So I encourage people to please join the fight against TB and to advocate for more financing that supports efforts on behalf of those affected, to ask policymakers and donors to listen to local voices and to fund solutions to local problems, and to finance all the tools, not some, that allow programs to provide equitable access to TB services for prevention, diagnostic, and treatment, and close to where people live and work. And also to finance not just TB-specific activities, but also support health system strengthening. Because without that, countries are unable to integrate services across other diseases and create sustainable models